Hello everyone and welcome to our group presentation on selection in human resource management with regards to emergency department. So myself Abhishek Chauhan and other three group members named Darshan Waghela, Saurav and Bhumi Parwar, we all will discuss about this in detail. So throughout this presentation we will explain how managers select the most crucial and important candidate for the emergency department using various structured and evidence-based human resource process. So each section focuses on a specific selection step and connects it to the both human resource theory and healthcare practice. So first one, what is selection in human resource management? So selection is the process of choosing the best candidate. Goal is to match candidates while knowing their knowledge, skills and abilities to the job demands. In healthcare settings, high quality selection is essential for patient safety and functioning and workload management. So in human resource management, selection refers to the process of choosing the most suitable candidate from various pool of applicants. The goal is to match each candidate with the knowledge, skill and abilities with the requirements of the job. So in healthcare settings, like the emergency department, this process becomes even more important because poor selection decision can affect patient safety, team performance, and workload distribution. So a strong selection process helps ensure that only competent, ethical, and well-prepared individuals are hired. So next, we will see why selection matters in the emergency department. So in the emergency department is, as we all know, that it is a fast-paced and unpredictable and high-pressure environment. So mistakes in hiring can affect patient outcomes, staff burnout, safety, and organizational efficiency. So evidence that informed human resource improves practice, structured, valid, and fair selection process ensures competency. So the emergency department is one of the most unpredictable and high pressure environments in the healthcare settings where nurses and other staff members must able to follow the multitasking skills. They should be able to make fast clinical judgment skills, and they should manage various life-threatening conditions in the day-to-day life. So a mistake in the hiring in the emergency department is not just an administrative level issue, but it can lead to various medical errors, increased stress, increase the nurses burnout ratio, and it also reduces the quality of the care which gets the patient. So this is why human resource managers must rely on fair, structured and evidence-informed decision practice. This practice reduces the biasness and ensures that only competent and self clinicians enter the emergency department work area. So next we will see the presentation overview. So in this presentation, we will covering the five steps. First is reviewing resumes, developing interview questions, weighing candidates, administering tests, and making a job offer. So in this presentation, we will walk through the five major components of the emergency department hiring process. So first is reviewing the resumes of the identified qualified applicants who had applied to the position. Second is developing the interview questions that assesses the clinical judgment and the teamwork. Third one is applying candidate weighing to make fair comparisons in various given critical situations. Fourth one is using the job related test to evaluate skills. Like hiring manager will ask some questions or they would be having a form of set of form questions which the interviewer need to ask. And finally, if the interviewer thinks like he is an appropriate candidate, then they will discuss on the next steps like giving a job offer based on their legal requirements and everything. So each step plays a key role in ensuring a safe and effective emergency department team.
Hello everyone. I am uh, reviewing. I am explaining some important topic. First one is reviewing resume. So, when reviewing resume for an emergency department position, the focus is on identifying whether the candidate has the essential qualification to work safety in a fast-paced environment. At first things we look for required certifications like BLS, ACLS, PLS, and TNCC, which shows the readiness for emergency situations. We also examine their previous experience, especially if they have worked in the emergency department, ICU, or other acute care areas. Uh, this setting help develop a strong assessment and multitasking skills. We also look for qualities such as critical thinking, leadership roles, and continuous learning. At the same time, the reviewer watch for red flags like frequent job changes or vague description. The goal is to review every resume constantly and objectively. Now is a resume screening based practice. So to make resume screening fair and consistent, manager use a structured based practice. The most important is a scoring rubric that evaluates each resume using the same job related criteria such as experience, education, and emergency certificates. This helps eliminate personal bias. Many hospitals also use applicant tracking system to filter applicants who do not meet essential qualifications. However, human review is still important to make final decisions. Another best practice is avoiding influence from personal details like age, nationality, or gender. Some organizations even use blind screening to remove identifying information. Overall, overall best practice ensure resume are evaluated very transparently and in alignment with the patient safety standards. So now it's developing interview questions. In the emergency department hiring process, interview questions must go beyond basic knowledge and explore how candidates behave under pressure. We use two main types of questions: behavioral and situational. Behavioral questions ask about the past experience. For example, tell me about a time you manage a deteriorating patient. This show how candidates have respond in real life situations. A situational question focus on they would do in a hypothetical but realistic scenario, such as how would you prioritize when two critical patients arrive at once. This help assess critical thinking, communication, teamwork, and patient safety awareness. The goal is to understand whether the candidate can stay calm, make a quick decision, and collaborate effectively in a stressful environment. So, now I'm explaining structured interviews. Structured interviews are used to ensure fairness and consistency in hiring. This means all candidates are asked the same set of job related questions in the same order. These answers are scored with a standardized 5-point rubric, which helps reduce bias and makes the process legally. A panel usually conducts the interview, often including a charge nurse, an educator, and an HR representative. Each member evaluates the candidate from a different professional perspective, improve reliability. Structured interviews make it easier to compare candidates objectively, justify decision, and ensure the person selected can handle the uh, fast-paced, high-risk emergency department environment. This approach supports patient safety and strong team performance.
Thank you so much, Rashmi. My name is Bhumi and I will explain weighting candidates by scoring system. So here are the five weighting system. So first one, these describe the candidates weighting helps the manager compare to another candidates. For example, people who have a clinical expertise, they are measured at 30%. How they communicate and how they work as a team, they are measured at 25%. People, their critical thinking skills are measured at 20%. People who past people have experience in emergency department, they are measured at 50%. And lastly, professional and clinical references are measured at 10%. These systems ensure the competencies most essential for emergency success carry the most influence in the final evaluation. That can make help to the manager. Waiting also makes the selection process transparent and help to justify why one candidate is uh, chosen for another. Now I will explain why waiting matters. So it can reduce the impact of subjective judgment or gut feeling. It is also ensure that every candidate is evaluated fairly according to their work consistency and job related criteria, not just because of they have a good connections with their superiors. If a hiring decision is ever challenged legally or internally, the weighted scoring system provides clear evidence that the process was objective. Weighting also supports the complements with the Ontario Human Rights Code by ensuring an equitable selection process free of biases or any discrimination. Now I will explain test administration. In emergency care, hiring tests help to provide a realistic assessment of the candidate's ability. So, such as the clinical test may include ECG interpretation, recognizing early deterioration, or medication safety. There are many other assessments might include critical thinking scenario using tools like SPA, situation background assessment, and rational simulation test of a trauma situations or situational judgment test. These assessment help the manager to show the how people think critically or how they will react on some situation. This assessment must always be reliable, valid, and directly related to essential job duties. These tests also help the reduce the risk of hiring someone who may not be clinical ready for the emergency department or may not be able to work in that emergency department. It can increase the productivity and also it can promote the safety. Now I will explain ethical and professional consideration. So first one, testing must always follow ethical and legal principle, which is most important in hiring process. Employers must ensure that assessment are free of any discrimination and accommodate disabilities whenever they are required. Candidates also need to know that the purpose of the test and the result are always to store in confidentiality. And lastly, to maintain legality defensible, test content must connect directly to the essential emergency department competency. This maintains fairness, protects candidates' rights, and align hiring process with the professional standards. Thank you so much.
Hello everyone. Now I will talk about making the job offer. The final step in is selecting the top candidate based on all evidence gathered. Resume scores, interview results, test and reference checks. Before making an offer, the manager must verify the candidate's credentials, police checks and certifications. Most organizations provide a conditional job offer. Pending these results, the offer must also align with the internal HR policies, collective agreements, and organizational pay structures. A clear and structured job offer reinforces professionalism and transparency in the hiring process. Now we will talk about summary of key points. In summary, effective selection is essential for ensuring safe, competent, and reliable performance in the emergency department. Each step of the selection interview, like resume screening, interviews, weighing, and testing, must be structured and evidence-based. Following standardized HR practices help reduce turnover, strengthen teamwork, and enhance patient safety. Ultimately, good selection supports both the organization and the patients who depend on the emergency services. Connection to HRM themes. This topic relates to several major HRM themes, including strategic HR planning, equity and inclusion, legal compliance, performance management, and competence-based hiring. ED demonstrates how HR strategies directly influence patient outcomes, workforce stability, and organizational effectiveness. By applying HR theories to healthcare settings, we ensure high quality care and safe clinical environments. These are the academic sources we used to support our presentation. Thank you very much.